Welcome and thank you for joining us for vision care, mental health, and physical well-being during COVID-19. My name is Kathy Chern and I am a consumer health librarian at East Brunswick Public Library. Today's program is brought to you by the Center for Asian Health at St. Barnabas Medical Center and the library's Just for the Health of It initiative to promote community health and wellness. Our speakers today are Dr. Lillian Cheng, ophthalmologist, Dr. Kate Bellucci, physical therapist, comprehensive outpatient rehabilitation at RWJBarnabas Health, Dr. Pei Chen Su, New York, New Jersey licensed psychologist, PhD in counseling psychology, and Nannan Wang, community liaison at the Center for Asian Health at St. Barnabas Medical Center, RWJBarnabas Health. Please be aware that this talk is being recorded. Please keep your microphones muted and your webcams off. The recording will be available at ebpl.org/YouTube. If you have any questions, please type them into the chat box. The doctors will answer questions at the end of the talk. The doctors presenting will not be able to offer personal medical advice to attendees during this program. And without further ado, I will turn things over to our first speaker, Dr. Cheng.
Hi, I guess I'm the first speaker. I'm Lillian Cheng. I'm an ophthalmologist. I've been practicing in New Jersey for the last since 2007, and generally, I'm actually a specialist in anterior segment and cataract cornea surgery, but I also do see a fair amount of general eye care. And today, they asked me to talk to you guys about something that's incredibly relevant. It is something that I have been fielding questions for constantly since the beginning of March when all of this pandemic began. It's basically concerns about eye strain and screen fatigue. Nowadays, everything has, or many things have moved online to virtual spaces. We are spending quite a bit more time on screens these days. We're going to talk a little bit about why it's happening, and then how we can potentially help ourselves to be a little less tired at the end of the day after a long day of, reading and staring at, our collective screens. Basically everyone is coming in saying, I'm spending way too much time on the screen. My eyes are hurting. I just feel very uncomfortable. So what are the main complaints? When people are talking about eye strain, this is actually very generic. What does eye strain mean? It can mean all kinds of things. When a patient comes in and tells me that they're straining their eyes, I have to actually specifically ask them, what is it that is bothering you specifically about your eyes? And a lot of times, they'll tell you all kinds of different things. I have people telling me that their eyes feel tired, or they look kind of red. They're especially red at the end of the day. They're watering constantly. They're stinging. They become blurry after spending too much time reading. They're getting headaches by the end of the day. And then sometimes even their muscles feel a little tired, that they just kind of want to shut their eyes. They feel like, I can't keep my eyes open any longer, or they think they're squinting too much. Let's talk a little bit about dry eyes. One of the biggest culprits for this, some of these symptoms is a dry eye. And oftentimes people don't even recognize it is happening. Normally, when we are doing anything, we are blinking, and that blinking actually causes tears to pass over our eyes. And so blinking is kind of like a windshield wiper, like we're spreading the tears down over the surface of the cornea, which is the front of the eye. But when we start concentrating, we really want to pay attention to the subject at hand, whether it's like reading a book or watching television, using a computer, driving, all those things will actually cause our brain to suppress the normal blink reflex. And then this, combined with if you have a baseline tear deficiency, or you're not making enough tears to begin with, or you have what we call an oil gland dysfunction. There's these oil glands along the eyelids that supply oils to our tear film. All of these things in conjunction can make it quite uncomfortable for us at the end of the day. As far as some of the symptoms go, some of the symptoms of dry eye could be achiness, some tearing, stinging, redness, blurred vision. And so one of the things about the blurred vision is that people don't realize that that actually is because their eyes are dry. The skin surface of the eye is like any other skin. And when it becomes dry, just like your skin might become a little gray or ashy or whitish, the same thing that happens on the surface of the eye. And that's actually what makes it very dry. Excuse me, that's what makes everything very blurry to us. So what do we do? Remember to blink or rest, basically. It's hard to remember to blink because it's such an automatic response. Normally, our blink rate is actually about 15 times a minute. But when we're concentrating on something, it might reduce to 5 or 7 times a minute. And we're really concentrating, we can suppress it altogether because we're worried about missing something. So, a lot of times it's all about resting your eyes and just remembering to take these physical breaks for your eyes. Number two, artificial tears. So there are these drops. I'm sure if you've been to an eye doctor, they oftentimes will tell you to use these artificial tears. They're basically lubricant drops. You can buy them anywhere at a drugstore. And there's many different types. And you may want to ask your eye doctor after having an examination about what formula may be best for you. But the idea is to be using this fairly frequently, enough that it's actually helping you. And oftentimes I'll remind all my patients to keep it somewhere where they actually remember to use it. If you put it in your handbag or your out of sight, it's definitely out of mind, and you might forget to use it, which will then lead to a little bit more suffering at the end of the day. So trying to keep it in front of you is often helpful. Beyond just the simple things, there are medications that can be prescribed for dry eye as well. There are drops such as Restasis, Xiidra, and Cequa, and these are all prescribed medicated drops that are anti-inflammatories. And one of the things about dry eye is that over time, if an eye has been suffering from dry eye for quite a bit of time, they will actually become very inflamed, and that will cause sort of like feedback loops that will make that surface of the eye less healthy over time. And so the idea is that putting in these drops actually helps to relieve some of that inflammation and leads to a healthier overall surface or tear film. These do need to be prescribed. They're generally used twice a day. There's minor differences between them. I typically just go with whatever the insurance might cover. Blepharitis. So this is that thing about the oil glands I was talking about. Blepharitis basically means that our oil glands are a little bit inflamed, and our eyelids and eyelashes are a little inflamed. Now, these are pictures of much more severe cases, but even minor cases can cause trouble with dry eye. I basically usually explain it to my patients that your tears are not just built with a fluid component. There's actually just a water component. There's also an oil component as well, and that oil actually helps to keep the tears from evaporating too quickly. And so, just like if you were to have, if you washed your hands over and over again, but never applied lotion, your hands would start to dry out and break down. So, it's important to get those oils healthy so that they're actually contributing to the tear film in a positive way. Basically, one of the signs is that you get these itchy eyelids. There's like a mattering debris that gets caught on the eyelashes. And, oftentimes patients will say my eyelashes are really crusty or they're stuck together in the morning. That's really a combination of dead skin cells and normal debris, dried mucus, and things like that. And that can actually clog everything up. So, generally I tell patients to use warm compresses, just a clean washcloth, hot water, wring it out and leave it on your eyes for a few minutes. That really helps to soften things up and opens up those oil glands. There's these gentle eyelid cleansers that are available over the counter. And then in more severe cases, you can have the meibomian glands expressed, or those oil glands can actually be physically cleared. And so there's different methods that can be done in the doctor's office to do that. Ponto plugs. We all have drains for tears in our eyelids. And so your doctor can also place little plugs. They're usually either permanent or dissolvable. They're not visible to other people. But what it does is it basically plugs like a drain of a sink. If you're putting in tears or producing tears, they won't drain out as quickly. And that will also help with the moisture levels overall on the surface of the eye. Now, Another symptom that people might be suffering from is focusing issues. And so, if you're staring at something close up all the time, your eye muscles are basically working overtime to try to maintain that focus. And that can actually get very exhausting at the end of the day. So, ophthalmologists have sort of come up with this easy to remember 20-20-20 rule. Basically, resting your eyes every 20 minutes. You might want to shift your gaze to something at least 20 feet away, or just basically looking out a window or just down, a hallway, just for 20 seconds, just to relieve some of that muscular strain. In addition, as we get older, we suffer from something called presbyopia, which means that we just start to lose our ability to focus on things. And that's why in our mid 40s, we all sort of start needing reading glasses, a little help to be able to see things up close. Well, there are specifically made prescription glasses that can be done for whatever distance that you are sitting away from your screen, typically about 20 to 26 inches away from the face. And this helps those internal eye muscles relax as we're doing all this near work and focusing. Glare. So eye strain can also be a result of working in an environment that's too bright or too dim. And if that screen is glowing brighter than the surroundings, the eyes are going to have to work harder to see. So you want to adjust the brightness to match your surroundings. And this helps to improve the contrast to make it easier for your eyes to be able to see. So I'll talk about the blue light glasses in a second. I think I had my slides out of order. Positioning is also important. You want to adjust your body and your seat, and I think we're going to hear a lot more about this from Dr. Bellucci. But basically, we want to be sitting at our desk about 25 inches away from the screen, and then adjust the screen so that our gaze is slightly downward, not straight or looking up. This actually helps the eyelids just sort of protect our eyes from a little bit more exposure or drying. For my office workers, again, keeping that bottle of artificial tears handy and actually remembering to use it. It's important that it's visible and in sort of the forefront of your mind. Occasionally, if you're working in a dry environment, a humidifier is also helpful in creating a better overall environment. And then avoid sitting directly in front of a vent or a fan, which could also be very drying to the eyes. So the blue light glasses that everybody is talking about, I probably get this question pretty much 5 times a day at this point because they're so in vogue right now. The blue light is basically the light that is emanating from a computer screen. The idea is that blue light can actually or potentially affect your circadian rhythms and trick your body into thinking that it's more awake. And so if you're using screens right up until like very late at night, right before bedtime, it might actually keep you from falling asleep because your body still hasn't sort of gone into that down mode. And so that's what those blue light glasses, were really designed for. They're not really truly necessary for fatigue. It does prevent glare. And, but you could also easily just do that by adjusting the screen brightness, just like we were talking about in that last slide. But it doesn't really, there's really no evidence that suggests that it causes actual damage to the eyes. Now, that being said, I know a lot of people use them and they like them. And I think it's really just that they're blocking glare. But truly, you don't really need them. But definitely continue to use them. They're not harmful. And if it's blocking that glare, making it more comfortable for you to see so you don't have to fuss around so much with your screen, I think that's fine too. But that's my take on the blue light. And that's actually mostly, the Academy of Ophthalmology has issued a statement on that as well. Now, as far as contact lenses, a lot of us do wear contact lenses as well, but those can also be really drying. The contacts are sort of, especially the soft ones, are kind of like little sponges that leach all the fluid off our eyes. And so, I generally try to tell patients to limit those contact lenses as much as possible. If you have to wear them for daytime, for work, take them off as soon as you get home. If you know that you wanted to wear them late into the night, then please, maybe wear your glasses during the day, have some break days where you're just using glasses. It gives your eyes a chance to breathe. It allows a lot of oxygen to get to those important stem cells that are located in our cornea that help us have a healthier surface. Never sleep in the contact lenses, even if they're labeled for extended wear. And I think I'm a big I'm a big proponent of not wearing contact lenses to bed. Even though some of those contact lenses are designed for that use, I have seen a lot of patients suffer from infections, especially if they have dry eyes. So I typically recommend that all contact lenses come out at nighttime. Using good contact lens cleaning, practices, making sure you stay up to date with exactly what that contact lens needs. And then, depending on the type of contact lens that you have, if it's monthly or 2-week disposable or daily disposable, all those lenses need to be thrown out after it had been opened and on the appropriate date. So when do you have to see your ophthalmologist? If your symptoms are still not improved, try to see your eye doctor. There's, like I said, there's many different reasons for this kind of eye strain and fatigue, and visiting your doctor can help hone in on that one cause, or a few causes, and they can kind of guide you as far as what's going on and how you can fix it. They can also look for pathologic causes for dry eye, such as allergies or eyelid disease, eye disease, medication side effects, and autoimmune disorders. They can check for muscle weakness. So there's a couple types of muscle weakness that can, diminish our ability to focus properly. And then also they can just, simply check you for a new prescription to optimize your vision with your workspace. And oftentimes it's actually kind of helpful to tell your eye doctor exactly how far you naturally sit from your computer or whatever activity that you're trying to do, to guide them, because then they can sort of work those glasses around what you are doing. There's not always a one size fit all solution. So that's pretty much my talk.
And so our next speaker is Dr. Kate Bellucci.
All right. Hi, everyone. Let me just get this screen shared. All right. Hello, everyone. Thank you to the Cancer Institute and the Center for Asian Health at St. Barnabas for having me today. I'm just going to talk about physical therapy during COVID and top things that we have seen throughout the pandemic and how to take care of yourself at this time. So my name is Dr. Kate Bellucci. I'm a physical therapist, and I work at the Barnabas Health Ambulatory Care Center. Been there since October of 2018. I graduated from Michigan State with my Bachelor of Science, and then Northwestern with my doctorate of physical therapy. I actually got married during COVID, so we were able to figure that out. And I also specialize in treating patients with neurological conditions. However, I do see patients with orthopedic conditions as well. So things that we'll cover today, we have 2 case studies that we'll talk about, some top ailments and concerns noticed in the physical therapy department, and general recommendations, and then contact information for our department. So first, we'll talk about a 59-year-old male with Parkinson's disease. He's been working from home since March at a desk in a swivel computer chair, and reported onset of low back pain that occurs toward the end of his workday. So some things that we talked about with him were a standing program, so trying to get up every 30 minutes during waking hours. And then changing his seating position and his placement of his work desk, and then raising the height of his laptop on his desk because he had been angling down all the way. Result, now he reports less occurrences of low back pain, especially on days when he's adherent to the standing program and changing positions, and performing core stabilizing and stretching exercises as well. So that's one thing that we've seen quite a bit of. Our second case study is a 39-year-old female with multiple sclerosis. So she had a fall in March during the thick of COVID and had a very bad ankle sprain after falling off of her porch. So she never followed up with her primary care physician or the hospital or urgent care because she was afraid to go. Naturally, because of her underlying condition of MS, made her more prone to potentially contract the virus. So she had significant pain and swelling over the next 2 to 3 months and wasn't able to come to outpatient physical therapy until the end of August, when she complained of continued pain, discomfort, and decreased ankle flexibility. So my biggest thing was to have her get imaging done on the ankle. Since she fell, she may have had a fracture or really torn something there. So we recommended that she get an X-ray or an MRI and then perform her exercises, and she had some manual therapy and physical therapy. So it took until October of 2020 for her to finally feel some improvement in the ankle pain. And now she is back to doing her regular walking and exercising without discomfort. But again, this took about 7 months for her to feel back to herself. All right, so what else have we been seeing in physical therapy? These are just a couple things. So we'll start from the top. Neck, back, and shoulder pain have been huge. So some causes, poor positioning or posture, prolonged sitting, which we're all kind of stuck doing right now. Poor desk setup at home, which you might have a better, more ergonomic setup in an office somewhere. Falls resulting in pain, and then muscle strains from performing outdoor home renovation activities or new exercise programs found online. So we're seeing a lot of people are starting to try new things, whether that be yoga or online exercises, or doing things at home, which brings me to this. We're becoming our own general contractors these days. Don't want anybody to come into the house, or need some new house projects. So we're working a lot on doing things at home that we weren't doing before. Some other things we're seeing are lower body injuries, like that case study. So ankle sprains resulting from falls, rolling an ankle during sporting activities or walking, or during outdoor activities. Plantar fasciitis is also something we've seen a lot because this is an overuse injury. A contributing factor can be improper shoe wear, but a lot of people are increasing the amount of walking they're doing because there's truly just not much else to do these days. Of course, now it's getting cold, so that'll just add something else to make it hard for us. And then also a lack of some stretching and strengthening program. This is probably one of our main things that we've seen now that people are coming back to outpatient therapy. So arthritic pain and general deconditioning. So causes of this: prolonged sitting, decreased overall activity levels due to quarantine, postponing of elective surgeries like knee and hip replacements that they would have gotten before. And then decreased strength just due to lack of use. We're not doing as much, not leaving the house, which may have been how we got some of the aerobic exercise in. So these are some important things to look out for. While this tends to be more so in the older adult population, we can see this all across the lifespan. So shortness of breath when you're doing activities during the day, weakness in the arms or legs, which make typical activities harder, difficulty getting up and down from the floor or lower surfaces, and then difficulty moving around in bed, or a new onset of falls. So an example of this, I had a patient who has Parkinson's disease and was extremely active, and then he had a fall and went to the hospital. And he was by himself at the hospital for about a month because his family was not allowed in. And by the time he got out, he was not doing as well, much slower to do things. His strength was low. He started falling all the time. So these are some scary results of not seeking services. Then TMJ dysfunction is something that we see as well, which is just jaw pain. So some causes are clenching and grinding from increased stress, poor sitting and standing posture, and you may notice associated headaches as well with this. And we have a TMJ physical therapist at Barnabas Ambulatory Care Center. If anybody has jaw pain, it's not so common to find somebody to treat this. So falls as well. So these can occur with or without underlying conditions, can cause or be a result of many of the stuff that we've talked about today. And they often happen within our homes and our yards, which is where we have been spending most of our time lately. This is another big thing, delaying of services. So a lot of people are afraid to go get the services that they need because of, fear of being in an outpatient environment. So delaying services for stroke, falls, concussions, or other medical emergencies, not receiving immediate required care by a physician or getting the necessary x-rays or MRIs that you need. And then not going to regular preventative appointments. That would be when we usually have our primary care say, it's time to go see a cardiovascular doctor, or it's time to go to a pulmonologist. We're not getting that if we're not going to those annual appointments. And then outpatient physical therapy or inpatient rehab are usually immediately prescribed in many of the cases that result in decreased function, such as a fall or a stroke. And that's when the outcomes are the best. But if patients aren't following up with these services, then we tend to see a problem there. So now let's talk about how we can decrease the chances of these things happening to you. So one thing is desk setup, which I'm glad was already spoken about a little bit. So having the top 1 to 2 inches of your monitor at eye level, elbows at 90-degree angle, with your forearms parallel to the floor and supported on armrests. Wrists in a neutral position, not angled up or down on the keyboard. Your knees at 90-degree angle with your thighs parallel to the floor. And then having your feet supported on the floor. So this is one where if you can't attain that position with a chair, a better way would be to have a step stool underneath your feet. That way you can raise your feet up to where they should be. And then having your low back supported with a towel or a pillow or a lumbar roll or an ergonomic chair. So here's some extra setup tips here for if you have a double monitor. So if you're using both monitors an equal amount of time, you want to set them up in a slight V shape with the monitors meeting directly in front of you. And then if you use one monitor more than the other, you can set the primary monitor in front of you and the other one over to the side if you're not using it as much. If you're on the phone often, using a headset will avoid this posture of having your ear down to your shoulder. You can turn your desk into a standing desk. And then if you're turning a sitting desk into the standing desk, remember to just follow those same guidelines and then sit as needed. So standing in one position for a long time can also be detrimental. So it's important to move around as you're able to and still walk around the house or do some squats or heel raises, something to get you moving during that time. So here are a couple desk setups. As you can see here in this first photo, you have the primary monitor in the front and then that other one to the side. And then this one on the right, you see his posture is very slouched. He has multiple keyboards. And then, the setup isn't as great there. Here's some other tips. So changing your position often, include 10 to 30 minutes of walking per day, and standing up every 30 minutes if you're primarily sitting for work or at school. Strengthening is also extremely important. So including 2 to 3 days per week of general strengthening of your major muscle groups. Listening to your body, especially when you're starting something new. And then with all of the lifting, twisting, and carrying, just be cognizant of your body mechanics. Keep objects closer to you, especially if they're heavy, bending at your knees and hips. And then for your jaw, we talked about some jaw pain that has been coming up. So be aware of your sitting and standing posture. Be aware of your jaw. Try to avoid that clenching and grinding that happens with increased stress. So a general guideline for that, if you're not eating, your teeth should not be touching at all. So your tongue should be up like you're saying no, the word no, and then your lips together and your teeth apart. Here are just some things that you can do for fall prevention in the home. No area rugs, nothing that somebody can trip over, using a walker or a cane if you need it, having grab bars or a shower chair in the tub, railings on all your sets of stairs. And then really important is preventative care. So speak with your primary care physician about all medications you're taking, have a balance assessment by a physical therapist, and another big important thing, have your eyes checked yearly. That can play a huge role in your balance as well, to tie everybody together here. So we are here for you. I have the number here to the physical therapy department if you have any questions. And also we have a rehab blog and a website. And on that blog, you'll actually find some of our most recent ones are about these exact things, how to stay on top of your wellness during this time. And we're here for you. Thank you. We'll wait for questions.
Okay, thank you. And then our next speaker is Dr. Sue.
All right, thank you for the Cancer Institute and Center for Asian Health for inviting me to share some tips that you might be able to use. I would like to share some, do some exercise today, actually. All right, so let's see. All right, so during COVID, I know that a lot of people are very anxious. They're worried about if they're catching the virus, and they also feel anxious when they're at home and not having the usual social or recreational activity that usually engage, so they can feel more and more anxious. So I want to kind of give people an idea of how anxiety starts in our brain. So as you can see, when we notice something, when we are becoming aware, the signal sent to the center of our brain, it has a few components in our brain, the thalamus, the hippocampus, and the amygdala. So this part of the brain is controlling our fight and flight responses. So when we see something or hear on the news of more cases, that this part of the brain can get activated. And so we can be reactive, and that's where the anxiety comes in. And the information further go to our occipital lobe and then send back to more messages to our amygdala, as you can see on this graph, that can help us to figure out if the cue that we're seeing, either by seeing or hearing, if they are really, a threat to our safety or not. But a lot of times that we do not, we act quickly, the limbic system act really quickly, that we might not, our rational mind may already be hijacked by this heightened anxiety that we experience. So we're not able to rationally figure out if whatever we're seeing, whatever we're hearing from the news is really threatening or not. So when that happened, that we all know that we have in our nervous system, there are two sides of the system. One side is the parasympathetic nerve system, and the other side is the sympathetic nerve system. So when our fight and flight center get triggered, the sympathetic nerve start to get activated. So our heart rate start to increase, and then we start to get, we get heart palpitation. That's where a lot of people feel when they feel anxious. That's what happened to them. Their heart rate start to go fast, and they start to have their stomach feeling turning, because that's where we need to start fighting. So our system is helping us to fight. And our stomach will start to inhibit activities, and so we don't feel that we have a good appetite, you don't feel like eating because the activity in the stomach slows down. And it all affects our body in some certain way. Okay, So when we get anxious, that's what happens. So if I tell you there is something that you can do to help the sympathetic system to slow down, to not to be overreact, because if we are just worrying about we can get COVID or things can get worse, and things are actually not getting worse, but it's the worry and the anxiety is escalating, that we are kind of living in our anxiety, but not really living in the reality. So one thing that we can do to help us slow down and kind of calm the amygdala, calm the limbic system of our brain, and to be able to like look at what's happening right now and have a more realistic judgment of what's happening. So this thing that we can do can reduce stress, can reduce anxiety, it can lower blood pressure and heart rate, it can even grow the brain size, it can grow like our concentration and attention. It can actually also, when we do this often enough, it can change the gene expression in our immune system. So if you know about this, would you do it? I hope you would. So it's called diaphragmatic breathing. A lot of time I also say that abdominal breathing. You probably heard of it, but many people that I know, well, I think more and more people know about this. So a lot of people, they know about it, they don't necessarily do it. So I would like everybody to try to take a deep breath right now and notice how your body feels. Okay, so when you took that deep breath, if your chest is you notice that your chest is rising up and your belly is going down and your chest is rising up, that's not really abdominal breathing. Okay, because what happens is that we only use, when your chest is going up, we only use the top part of our lung to breathe. The correct way of doing abdominal breathing is that when we breathe in, our belly goes out. Like this graph on the left, when we inhale, the air comes in to the bottom of your lung and your belly is going out. And when we exhale, our belly goes in and the air comes out. Okay, so I would like everyone, I actually would like to stop share. Well, oh, I don't need to stop share. Okay, so if you can do this exercise together, I'm going to ask you to do 5 breathing. Inhale, your belly goes out. Exhale, your belly goes in. Okay, let's try to do this. Breathing in, belly goes out, and breathing out, belly goes in slowly, and breathing in, belly goes out, and breathing out, belly goes in. If you can try to focus, continue to do this, and put your attention to your nose, and notice the air slowly goes in and slowly go out, as slow as possible. Let's do the 4th one, slowly breathing in, belly out, and slowly breathing out, belly goes in. It does not really matter if you use your nose or your mouth. A lot of people may have problem if they have sinus problem and they may have a hard time use their nose. It's okay, you can use your mouth. It would be best if you can use your nose, okay? And then another very important trick when we are doing abdominal breathing is to count to 7 when you breathe in and count to 11 when you breathe out. the trick is when we're breathing out, we want to make it slower. A lot of people do deep breathing. They do this, and they breathe out really quickly. So that actually does not induce enough relaxation feeling and doesn't send that signal, relaxing signal to our brain. So let's try that. I'm going to count. Slowly breathing in, 2, 3, 4, 5, 6, 7. Breathing out, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. If you cannot hold until 11, that's okay. Just do the best you can. And just think about that you want to try for the next one to make the exhale as long as possible. All right. Let's try again. Slowly breathing in, 2, 3, 4, 5, 6, 7. Breathing out, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. Okay, I hope that I didn't get to interact with the audience today, but I hope that you do feel a little bit different. That you can see that when you exhale slower, usually people feel this like relaxation feeling wash over their body, and they are able to have a clear mind. So this is just another graph, as you see that if we are breathing, letting our belly go out, meaning that the diaphragm is going lower, that their lungs actually have more space to take in more air. Okay, I'm aware that we have, not sure how much time I have. The other exercise, there are other exercises that can calm our mind. And today I want to do another one, hopefully maybe 2 minutes. So we're going to do another imagery exercise. The second one is called healing light or healing color. I would like you to think about like a color or a light that if you think of that color, it gives you this soothing or nurturing and calming feeling. Each person is different. The color can be green or blue or turquoise or yellow or white. So whatever that made you feel relaxed. And then I want you to think about this light. It has a temperature. If it's cold, is it hot? Again, like this is your special light, your special color. So you can make it whatever temperature you like. And when this light, we're going to imagine this light coming down to you from the top and going down from the top of your head and going down slowly through your body. When this light touches your skin, how does it feel? Okay, I want you to, like, is it smooth or is it ticklish? And when the light comes down to you, do you want it to go through you or do you want it to go around you? And you can also imagine this light carries a scent. Do you like the scent to be like the sun? Or do you want the scent like the beach? Or do you want the scent to be like in nature, tree or lavender? Any scent that you want to imagine that would give you this sense of calm. And finally, this light can also have a sound. You want the sound to be really, really quiet, there's no sound, or you want the sound to be some melody that made you feel happy or made you feel calm. So any sound you like. So I want you can close your eye and imagine this light coming down to you. It can come down like a straight line if you want. It can come down like something that surrounds you, enveloping you. And slowly you notice the light going down to your forehead and to your eyebrows, to your eye, and to your cheek. This light can also soar around you if you like. This is your special light. You can make however you want the light to be. And you are secure. And it goes down to your neck and to your shoulder. And you let yourself enjoy this special light. You see the color. And you feel the texture. You smell the scent. And also, if it's quiet or it has a very nice melody, you let it go to your chest and to your belly and to your lower belly and to your thigh and to your knee and to your legs and to your ankle and to your feet and to your toes. And let yourself enjoy this feeling. All right, I hope that was relaxing for you. Feel free to use that a lot of time, like when you feel like you need a break from, your anxiety. When you feel like there's a lot of stress, take that 5 minutes break to do this imagery exercise. A lot of time it can help you like reset and then prevent people from going down the anxiety spiral. So I hope that's helpful.
Thank you, Dr. Chang, Dr. Bellucci, and Dr. Su for taking the time to present on this topic and to answer our questions. The next topic in the series is Nutrition for Colorectal Health and Cancer Prevention, tomorrow, November 3rd. English session at 4 p.m. and Chinese session at 5 p.m. Thank you, everyone, for joining us for today's talk. Take care and stay safe.